Welcome, everyone, and Happy New Year to you. Thanks for joining the OAS Connect Facilitator Learning and Engagement Opportunity. We hope to offer additional facilitator engagement opportunities throughout the calendar year. So this is our very first, and we're so glad that you have joined us. Today's webcast is going to be recorded, and we'll be uploading the recording to the OAS Facilitator Resource Center after the event. I will stop the recording after our speaker presents for our question and answer period, just to give you all the opportunity to ask your questions, and those don't need to be recorded. All right. So let's get started. So today's workshop focuses on a real-world implementation experience. We're going to explore practical strategies. We're going to discuss data collection and learn from a successful program delivery. Our goal here is really to provide you with concrete insights that you can apply to your own OAS programs. I've outlined a few learning objectives for our call today. The first being to understand strategies for overcoming common implementation challenges such as securing school participation and managing consent processes. The second would be apply best practices for stakeholder collaboration. This could include working with school-based health centers and providing healthcare and healthcare providers. The third learning objective is around recognizing effective approaches for program coordination across multiple schools while maintaining quality and engagement. And then the last one, developing strategies for measuring and demonstrating program impact to support sustainability. So we'll start with a presentation from our featured speaker. It will be followed by an interactive Q&A session, and I'm also going to share some new resources with you here at the Lung Association. So please feel free to submit your questions anytime throughout today's presentation. We're actually going to use the Q&A icon. So in the upper tray of your webinar platform screen, you'll notice a Q&A box. If you click on that, it will open a side panel for you where you can ask your questions. So it would be a moderated, we'll moderate those questions at the end of today's call. All right, so I'm delighted to introduce you to our presenter today, Paulette Abbey. She serves as a cluster school nurse in Fulton County Schools. Nurse Abbey has 20 years of nursing experience, including 15 years as a school nurse. She oversees health services at 6 schools and has led initiatives in asthma care protocols and school-based health centers. She earned her Master's of Science in Nursing and Public Health in 2002 and serves on multiple state and local health committees. She was named Georgia's School Nurse of the Year in 2023 and recognized nationally in 2024. Paulette focuses on improving student well-being and academic success through comprehensive health services. So it is my pleasure to turn the presentation over to you, Paulette. And I'll give you a moment just to take control of the screen there. There you go. Oh, and you are on mute. There you
Good
go.
afternoon. There we go. Good afternoon, everyone, and thank you for participating. This will be our school district's 4th year in implementing asthma education within our asthma program. So a little bit about our school district. Fulton County Schools is located in Georgia. My role as a cluster school nurse is primarily case management and indirect care with students who live with chronic conditions. And in regards to asthma, we review the students' asthma action plans. We train school clinic staff and teachers on asthma care, warning signs, and we often follow up with the parents and the students when 911 is called from school. With our district, we have 26 registered nurses. 20 of them are cluster school nurses, 6 special education nurses. Our schools are set up for the clinic assistants in each school. They're unlicensed personnel, which we title as school clinic assistants. And then our district health services coordinator or director is a registered nurse. Within our district, we're the 4th largest district in Georgia. We have over 87,000 students within our district, and we're well diverse. Asthma management has always been a passion from a personal and professional level. I have 2 daughters with asthma and 2 grandchildren living with asthma. Also, based on our district school nurses' role and the number of students that have been identified with asthma, excuse me, and the low percentage of access to their asthma medications has led me to strive to make a change in the overall well-being of our asthma students and their families. On this current slide, you'll see over the past 10 years, the number of students that we have identified with asthma based on our parent report and our school database, which averages between 7,000 to 8,000 students within our district. And then you'll see the number of students that have access to an inhaler or a nebulizer machine is well less than 10%. As we implemented our district as an asthma-friendly school district, a few of the goals and guidelines that we previously had in place helped us to achieve this policy. A couple of the goals were included staff education. We often educate students and teachers and the staff on asthma education. We provide them with classroom tip sheets, which include an overview of asthma, signs and symptoms, and how to respond to an emergency, as well as instructions on administering inhalers for specific students in their classrooms. Our school clinic staff, because they're not registered nurses, they receive asthma training throughout the school year, and competency checklists are performed. Each Fulton County Schools employee has also been provided a asthma attack card from our Department of Public Health, which they can attach to their ID badge, and it reminds them of the signs and symptoms and how to seek emergency help. Our districts are also provided the air quality flags for each school so that they can monitor the outdoor quality to ensure students that need to make modifications to their school day when related to PE or recess have that information. With funding opportunities to address the asthma needs of our students in our community, we decided to apply for funding. Fulton County Schools was awarded a grant from the Georgia Healthcare Foundation to implement school-based asthma education and care coordination for underserved asthma students. This grant provided us the opportunity to hire an asthma care coordinator who was also a registered nurse. She assisted in implementing staff training and student asthma self-management classes such as the open airways and kicking asthma. In addition, with this partnership was also the Department of Public Health. They have been a key component in sustaining our asthma program. So with that contract, they also provide additional funding for us based on the number of classes that we teach. With our school-based asthma initiative implementation, we work with the principals because we have to have their approval to coordinate the sessions. As we communicate with the principals of the schools, we send out an informational email and we make sure to address key points that include reducing attendance and more seat time and improving their academics once the students are learning more about their asthma and how to manage. The principal then will identify someone in their school as a champion to assist us with coordinating the dates for the classes. So often it may be an assistant principal, a counselor, or maybe even our clinic assistant. And then as we work with that staff personnel, we find days and times that work best within the students' academic class time to pull those students from class. In order to work with the parents to obtain consent, we send home asthma letters. The parents will then, if they don't want their child to participate, then they will send the letters back to opt out. Additional initiatives of implementation, including coordinating with our school-based health centers here in Fulton County School District. We have three school-based health centers, as well as our children's hospital. We partner with them to come on site to the specific schools and do asthma assessments and evaluations with parental consent. And then that helps increase the number of students that have asthma action plans and access to their medication. As we implemented during our first year, I was able to become an asthma facilitator along with the asthma care coordinator, and we started our open airways for school classes as well as kicking asthma trainings that were led by the American Lung Association. And again, the funding and partnership within our Department of Public Health has provided our district with the opportunity to continue the ASME classes from 2021 up until present, as well as when we identify children whose asthma may not be well controlled and making appropriate referrals and care coordination with their healthcare providers. So these are key components in addition to providing the asthma classes to the students and providing resources to the parents. When we identify students who may not have their asthma well controlled, we want to work with their healthcare provider or our school-based health centers to help improve their access to care. There have been some positive outcomes since we've implemented our asthma program. So over the past 3 years, we've provided ASME classes to a total of 23 schools. We were able to educate over 304 participants. We felt that the students thoroughly enjoyed their sessions and they were very engaged. We believe that they were able to take away valuable information regarding their asthma, triggers, and ways to address their symptoms. If you, as a school nurse or as an asthma facilitator, if you're ever interested in seeking grant funding, just know that this will require data collection. With our grant funding during the first year of implementation, we were able to develop objectives and improve our goals. So just to share a little data, with our grant from the Healthcare Foundation, our grant objectives, we showed that 56% of our students who participated in our asthma sessions actually increased their overall academic grade percentage between their fall and spring semesters in 2020 and 2021. 46% of those students saw a 20% decrease in school absenteeism, and 17% of students who visited the school clinic for inhaler use decreased their number of visits by 20% during that academic school year. As well as with that grant funding, we had to ensure that we were educating the staff. So with the staff education, 60% of staff increased their score between a pre and post test after participating in our asthma training. With our study results, it showed a range of 10 to 40 point increase for those staff. Some of the challenges that we had when implementing our program, the first year we rolled out the asthma classes, the return consent from parents resulted in low numbers. Our initial parent notice or letter required for the parent to return the consent for their child to participate. What we learned that, parents may read the documents or, with language barriers, they may not understand. So we wanted to make sure that we had the letter in English and Spanish, whichever preference of communication that the parent needed. We also opted to change our consent to participate to a passive consent, which means we shared the information with parents, but if they did not want their child to participate, then they only returned the letter to opt out. This improved our participant rates threefold. Communication was the biggest challenge that we encountered. This included between parents, teachers, and staff. When we're coordinating the dates with the schools, we know that the principals, their focus is primarily academics and they have a lot that they're juggling. So it was a challenge getting responses from the principals when we were seeking to come in and coordinate the classes. We had to send multiple emails and sometimes even communicate by phone to make sure they understood the services that we were providing, as well as scheduling team meetings with the administrator so that they understood the services. Often when we sent communication homes with parents, like our asthma control tests, we sent those hard copies with the students. We would rarely get those back as well to collect that data. So sometimes finding out, paper copies may not be the right route, or deciding on how we're sending that home with students, because sometimes they think it's regarding their grades or that they're getting in trouble and they don't turn in the documents to the parents. We did find that utilizing interpreter services and calling by phone was a great asset to help educate the parents of understanding the documents and the resources we were sending home, as well as answering any questions that they had in regards to the asthma programs. In addition to the 23 schools that we serve, there were multiple schools that we weren't able to serve because of the lack of response from the school administration or non-parental consent. Staffing is a struggle as a school nurse because there is not enough time to coordinate and conduct classes. Additional school nurses or partnerships with asthma facilitators from the community is needed to provide student asthma educations throughout the district. Our current caseload prohibits expansion of our sessions, and decreased funding has resulted in termination of our asthma care coordinator position as well. So that has been a large challenge this year, losing that core care coordinator to assist with setting up the asthma classes. Asthma program implementation tips. Depending on if you're coordinating within the school district or out in the community near the school, you want to make sure that you're deciding on various factors like the time of the day, the location, and what the potential barriers may be. Last school year, we were able to implement sessions sooner in the year with the hopes to add additional schools. In our first 2 years, when school is first opening in August, that's a big challenge to get dates coordinated. So I would suggest starting to work or reach out to schools in September or early October so that you can get them scheduled rather than trying to get them scheduled as soon as the school year opens. Also identifying that school champion. If there's a paraprofessional or a clinic staff member, someone that can work closely with the asthma facilitator to get those dates scheduled, that is a true benefit as well. And then when communicating with the principals, we learned that that communication should not be too lengthy. When you're sending out emails, and just make sure you're including some type of language to address reducing absences and improving academics. We prepare all of our session modules in advance, including all of the lesson plans for each student, and we provide a separate folder for them to take back and forth with the parent letters from each session. Now that American Lung Association has developed a booklet, we're going to try to use the booklets this year to help reduce making those additional copies. So I'm excited to see how the booklet works for the students. Also, incentives are given out to the students for participating in the classes. So at the end of each session, we provide a little asthma education resource to take home, as well as a little gift bag with treats and snacks. And then at the end of our last session, we provide like a gray little drawstring bag. It has a lot of education materials, both for the student and the parent. And then we raffle off gift cards and/or tablets to help increase the number of asthma control tests that we receive back for the pre and post tests. Our future goals, we hope to continue the ASME classes for many more years to come. We hope to gain more grants or funding, so we would love to continue to expand our asthma facilitators within our district and hire an asthma care coordinator or another identified colleague to help support coordination of the services within our schools. Asthma care coordinator position, this has been a unique school position in our setting, but it has definitely shown to be successful and able to improve asthma students' health beyond the asthma management classes. As a school nurse, there are so many challenges with children managing their asthma, often being a lack of access to care, financial needs, and lack of the student and parent or guardian understanding asthma action plans and their medication regimen. So it's very important for me that we look beyond the asthma classes, because after we're educating the students, we want to ensure that they're attending school. They're not continuing to have asthma exacerbations or emergency visits or hospitalizations. We want to see a reduction so that they're in school more and truly understanding how to manage their asthma. As asthma facilitators, we are improving the health and well-being of children and their families. This is just a picture of some classes that we have provided. The first picture on the left, that's me and a student, as we know, with OAS and kicking asthma. Those are classes that typically start at age 8 and above. I often see children early on, pre-K, kindergarten, first grade. They're missing a lot of school. They're in the hospital for asthma. So I would work with them one-on-one and teach them about asthma and provide those parents with resources as well. The other two pictures is myself and our asthma care coordinator providing the OAS classes. The students are really engaged. We take the time to have them, read the stories in the lesson plans. We ask additional questions and give them scenarios as well to kind of act out when we're doing the classes. And then just to end out, every school should be asthma friendly. And in our school setting, we always say empty seats can't learn, and education saves lives. Thank you.
Fantastic. Thank you so much. I'm going to take control back from you. That was an amazing presentation. I just want to thank you, Paulette, for sharing your valuable experience implementing open airways for schools across Fulton County. I think your journey from achieving an asthma-friendly school district status to reaching hundreds of students with asthma education really provides a roadmap for other schools and facilitators who have joined us today. So as Paulette emphasized, every school should be asthma friendly. I couldn't agree more. So at this time, I will invite you all to begin to enter any questions you might have for Paulette into the Q&A box. And we will get to some questions. We'll have a question and answer period right at the end, but just a few questions that I thought of just to sort of get the conversation going and getting our listeners thinking. I thought it was so interesting when you're talking about how the school, engaging the school principals. And so I was wondering if you could share just a little bit more about some of those strategies that you've found most effective for securing that school participation, um, and identifying asthma champions. You had mentioned that email, but are there other ways to um, that you are working or getting the message out to school principals and schools, that you think might be helpful?
For me, so within my cluster of schools, often when I'm making clinic rounds or school rounds, if I can get a few minutes directly with the principal or assistant principal, I share information about the asthma program, or I'll even say, do you know out of your 600 students enrolled, you actually have 40 students identified with asthma? And then share that information based on data through the CDC and through the National School Nurse website, just the importance of educating the students and keeping them in school. Or if there are specific students that I've worked closely with, I'll even bring up those specific students' names to the principal. Do you remember we called 911 2 weeks ago? Or, this student was recently hospitalized for their asthma. This would be a perfect time to allow asthma classes for your students, because they're not only learning and able to self-manage, but then they'll begin to advocate for themselves and for others. So, just thinking of key points to catch that principal's eye or get them thinking, oh, yes, that's great. I think the biggest challenge is trying to identify the time frame, because a lot of times, well, they're testing at this time, or, math or science is a core class, so we don't want to schedule it at that time. And what we found is that typically the schools will schedule during their specials, meaning PE or art or music, or during their lunchtime. So it can be like a lunch and learn, or during, which goes on into recess. But what we've also found, the older the students are, they may be more upset or disruptive because it's taking their social time from their friends. So, depending on the school, we've had to go back and say, it was great that we've done the class at this time, but can we change the time, first thing in the morning at 7:45 before they really get started with academics? We've started as early as that time to do the classes as well. I've been considering even after school, because a lot of our elementary schools have like after school programs. So if there's some schools where parents are willing to, pick their child up after school if they stay, if they have access, to transportation, that may be also an opportunity that we can have. But for the most part, a lot of our principals, they've allowed us to pull out outside of those specials and the lunchtime.
Great. I think the other aspect that you talked about were these partnerships that you developed within your community, with school-based health centers and even the healthcare providers. I thought that was so interesting, and just wondering if you could just share a little bit more about how you developed those partnerships in the first place.
Okay. So, as a member of our Georgia Department of Public Health Advisory Board, Asthma Advisory Board, that provided a lot of networking and to be able to talk with healthcare providers directly. With our children's hospital, they have mobile services, which they provided a lot with our immunization. So they travel throughout the district as well as throughout the state, and they are available to partner with our school district to provide services. So they're starting to focus now on the asthma in addition to the immunizations and well child checks. So it's just been, I think, a big push out in the community to address these chronic health conditions and, service the child as a whole. So what we do is once we identify students that there is a need, then we just contact our children's hospital designee, and then we schedule a date, and then they come out and provide the services. With our school-based health centers, because we have two little doctor's offices in two of our elementary schools and one in our high school, they have been a key component, even though they're assigned to 3 physical schools. Because of that partnership we have with them, if there are students identified that don't have an asthma plan or don't have access to their medication, once we receive consent from those parents, they will travel to that school, and we work together. So I meet that healthcare provider at the school, we implement a schedule, and then we pull those students from class, just like a mini doctor's office, and work on those assessments for those students.
Great. Well, fantastic. We do have one question in our Q&A. It sounds like you added a lot of really cool things on top of the regular OAS Facilitator Guide. I'm just curious how much time you spend preparing for OAS each week. Did you host one session a week for a total of 6 weeks, or did you choose a different way to implement the program as well? So 2 questions there.
Okay. So first question, when we implemented our asthma care coordinator, she led all the organization and coordinating of the schedule. So she probably worked anywhere from 15 to 25 hours a week preparing. And then with the sessions, what we do with the sessions is we do 3 consecutive weeks, but we do 2 sessions per week. Because what is also challenging is if you go to a principal and you need to pull a student for 6 sessions or 6 classes, that's a lot of time. So based on OAS, we coordinate 2 of those 1-hour sessions for 3 weeks and kind of condense, but make sure we're hitting the key components of the curriculum.
Got it.
Yeah.
Perfect. And then oh yeah, and you answered that that second question. So perfect. Don't see any additional questions at this time. I'll invite others. If you do have questions, please put them into the Q&A box. For those implementing or expanding open airways for schools in your community, just remember that success comes through collaboration, systematic implementation, and persistent engagement with all stakeholders. I think that was a key takeaway that I heard from your presentation, Paulette. So while you're thinking of questions, I'm going to present some new resources from the American Lung Association, and then I'll actually stop the recording and allow us for additional questions. If people want to come off mute, I will stop the recording and we can do that. All right, so Paulette mentioned every school should be asthma friendly, and we couldn't agree more. In 2024, the Lung Association launched our Lung Friendly Environments for Youth initiative. This includes 11 topic areas from the School Health Index that includes strategies for addressing asthma, tobacco, and clean air, and more in schools and community organizations. Participants are encouraged to take the assessment. So you see that little green button in this screenshot. And within each section, participants can find resources that support the topic area of interest. The links will take you to landing pages to learn more and direct access to online learning opportunities as well. So the quick URL for that is lung.org/youth. And I'll be sure to send along any links at the end of today's presentation as well. Paulette mentioned our OAS participant workbook, and I just wanted to make sure you all were aware that we have this new resource. In 2023, we launched the participant workbook. It's a 52-page full color workbook. It's used by the child participants during the program. It incorporates the OAS posters, the child handouts, the parent letters, the progress report, and the certificate of good asthma management all in one resource. And at the end of the program, participants are encouraged to take it home to use as a resource and share with their families. I will say that facilitators have a choice to continue to print the child handouts and parent letters, or you can use the participant workbook. Some of our facilitators have started to incorporate the workbook into their program delivery. However, they're actually recommending to continue to print the parent letters for students to take home so that those workbooks can stay in the classroom and be available for the next lesson. So if you are interested in ordering participant workbooks, they are available for on our health education store. So this link will take you to our health education store where you can order the OAS participant workbooks. They are available in English and Spanish. The other new resource that I'm excited to talk about, as Paulette even mentioned, resources to reach early childhood participants. So we developed Asthma Superstars. It is a free interactive storybook adventure. It helps children ages 5 to 7 learn about asthma through fun activities and colorful characters. Children will understand how their lungs work. They'll recognize and avoid triggers, learn about medicine, and know what to do during a breathing emergency. So this engaging learning experience is perfect for parents. It can be used by teachers, school nurses, and healthcare professionals to share with young children. It is a 15-minute brief online course, and it includes an activity guide with coloring pages and activities for kids that can be downloaded at the end. So if you're looking for something for a younger audience, we encourage you to check it out. This lives in our Lung.Training platform under something we call Asthma Spotlights. We plan to upload additional quick learning opportunities. So Asthma Superstars is really our first to exist under Asthma Spotlights. So we encourage you to take a look. All right, and one other resource that I wanted to mention are some newer resources that we just published that are now available from our asthma medication in schools landing page. We had worked with a group of experts on some of the key challenges and to identify some strategic solutions around really 5 barriers to implementing a stock asthma medication program. So we have launched those 5 new guidance documents, and we've put them together into our program, stock asthma medication program implementation guide. So you can visit our asthma medication in schools landing page, access all the resources that we have on stock medication, but if you're looking for some implementation guidance, we have this brand new resource for you to check out as well. So there are many ways to get involved with us here at the American Lung Association. One way to engage with us is through our social channels, Facebook, X, Instagram, YouTube, LinkedIn, and TikTok. Please plan to stay in touch with us. If you get stuck, please don't ever hesitate to reach out. You can send an email to oas@lung.org, and we look forward to working with you. Be on the lookout for facilitator announcements. We send these at least twice a year and more often usually. We like to highlight facilitator stories, successes, and lessons learned. So it's a great way to stay engaged with us. We'd love to hear from you if you are interested in presenting your story, much like Paulette did today. We'd love to feature you on one of our upcoming calls. So definitely let us know. All right, and with that, I'm going to stop the recording and allow some time for questions from our audience. And I just, before I do hit stop on the recording, I do want to just thank Paulette for sharing your experience implementing open airways for schools. We will be hosting another Facilitator Connect workshop in the spring. Again, we're looking for presenters and ideas, so please let us know in your evaluation or send an email to oas@lung.org. All right, and with that, I am